Hello everyone, my name is Dr. Joel Rosen. I am a adrenal burnout recovery ninja, and today I want to talk to you about adrenal fatigue recovery and a functional medicine approach. And this is an actual case that is in my office that she is getting great results, and I thought it'd be really informative for you to hear sort of like an inside look over my shoulder autopsy, if you will, of a case that we're working on now. So this patient is a 38-year-old mother of two, and she has been suffering for years and years and years. She said 14 years of fibromyalgia pain. She's been to a lot of doctors, and she's not really getting the answers that she's been looking for. And I'll tell you why in a second. She has upper back and neck pain. She's unable to sleep. She has no energy. She's got gastrointestinal disturbances. She had asthma when she was 11 years old. She's been on a lot of antibiotics, and that should raise a yellow flag for a doctor, because what happens is when you've been on a lot of antibiotics, that tells us that you have a lot of gastrointestinal difficulty, because that atomic bomb-like approach of taking antibiotics not only blows up the good, healthy, bad bacteria, but it also blows up the good, healthy bacteria as well. She's been on a lot of painkillers. She thinks her father had fibromyalgia, so there may be a genetic component, and she has difficulty with concentration, and she just has no energy whatsoever. So what we did was we started with her back in June 9th, and today is August 18th, so not even about 3 months ago, or actually 2 months ago. Only 8 weeks. And so on 5/31 she came in, and her blood work pretty much showed nothing going on, although she didn't have a lot of blood work in there because it was incomplete. But the blood work that we did see, we were able to take and extract some really important information, which I think you should look at. First of all, her blood glucose was 63. And so if you look at the lab ranges, it's 60 to 109, and 60 is just ridiculous. If your blood sugar is lower than 60, you're considered hypoglycemic. But with a functional range, if your blood sugar is below 85, you're considered reactive hypoglycemic, meaning you get shaky, lightheaded, irritable if meals are missed. And certainly this is going to be one of the major adrenal gland disruptors, because her blood sugar is simply falling way too low. It's at 63. When I asked her, do you have a breakfast? Not all the time. She says she's not even hungry in the morning. She's nauseous. She waits a lot throughout the day. She relies on caffeine and stimulants. It's almost the picture-perfect adrenal fatigue patient coming into the office. And so she was at 63, and it should be between 85 to 99. I don't even know how doctors can tell patients that 60 or lower is a problem. In fact, I'll tell you, I have a little bit of a bone to pick today. Today I had a patient come in to see me, and she's been doing great, and she's been on a detox, and her friend was suggested to go on the detox, and the friend showed the detox to the endocrinologist that she sees, and the endocrinologist basically said to her, you better be careful taking this because you could die, quote unquote. I mean, how ridiculous is that? You can die. And we're not taking her off of medications. We're cleaning up her gut. We're removing foods that she could possibly be sensitive to, or she has type of allergies to. And also this doctor is actually in violation of the Hippocratic Oath, which means don't do any harm to your patients. He's doing harm to something that she could benefit by removing these irritants in her food, cleaning up her gut. These are research-based, peer-reviewed journals that show these supplements are helpful, or these compounds in these supplements are helpful. And he's telling her you could die. I mean, that's just ridiculous. So anyways, the blood glucose is 63, and it should be between 80 to 109. Her hemoglobin A1C was 5.6, and it shouldn't be above 5.6. So she was creeping up there. So how could that be if she's got normal blood sugar according to the lab ranges? but she's getting close in terms of her 3-month average of her hemoglobin being or glucose being high. How could that be? The reason that could be is because she's reactive hypoglycemic and she's bordering on insulin resistance. And so what that means is when you have too high blood sugar, you become insulin resistant because insulin levels are too high. When you have low blood sugar, you become insulin resistant as well because you're causing insulin to secrete so that it can get whatever remaining blood sugar out of the bloodstream and get it into the cells. Her total protein was 6.6. That's not how much protein she eats, but that's protein in the blood. And protein is necessary for hormone production, for carrying vital nutrients, for making things. It's basically the skeleton of making things happen in the body. And so she was 6.6, and from a lab range, 6.1 to 8.2 looks like it's normal. However, 6.9 to 7.4 is the range. And so when I see a low total protein like that, I know right away she's got absorption issues, something called hypochlorhydria. And what that means is as you get older, you don't secrete as much stomach acid. And so that food just kind of sits there and ferments and creates a gastric reflux and inflammation and problems with the adrenal glands and bloating and irritation to the stomach and brain fog. And so she needs to work on digesting her foods a lot better. Her lactose dehydrogenase wasn't even measured last time, and we'll get into that in a second. Her cholesterol, here's a really important lesson. Her cholesterol was 178. And the lab ranges are 100 to 199. Again, 100. If you're lower than 150, you're too low. 100, several doctors will say the lower the better, and that's just simply false. The problem with that is that cholesterol is necessary for producing hormones. And so we get scared, we get this scary death threat that if you go on these supplements you can die, or if you don't go on cholesterol you can die. Listen, 25 years ago, the cholesterol mandate for everyone to get on cholesterol, to lower their blood cholesterol levels, to help with the incidence of cardiovascular diseases. And 25 years later, there's been no improvement whatsoever, except these multi-billion-dollar companies have gotten more and more rich. So if your cholesterol is lower than 150, it's too low. You need to eat healthy fats, saturated oils, or you can eat coconut oils is great. Olive oils are really wonderful. Nuts, seeds, avocados. I mean, don't be afraid to take in fat. In fact, I'll show you. In her case, she went from 178 to 163. So what happened there? In 2 months, her cholesterol went down, and that's because she didn't help with taking in her intake of healthy foods or foods that have high, good quality fats in it. And I'll be talking to her today about that. Also, her TSH, so it wasn't measured last time, and this time it was 5.13. So I can only guess where it was before. That is high. Optimally, it should be between 0.45 and 4.5. So she is elevated. We don't know where she was before, but we can look at her other thyroid markers. She didn't have any thyroid antibodies, which is good because it means that she's not autoimmune. Her T3 was low, but her T4, her total T4, and all the other indications were normal. So that tells me that her thyroid is overstressed from her adrenal glands and it's not functioning optimally. And so what we're going to do is we're going to continue to manage her naturally, and if we find that this doesn't improve over the next couple months, we may suggest her going on some kind of thyroid support, but we're going to use some thyroid support natural stuff. The last thing we need to talk about is what's sort of the X factor. Now, she had platelet levels that were low laboratory-wise, and her white blood cell levels were low from a functional range. What that tells me is she has some kind of immune compromise, some kind of virus, some kind of toxin that is stressing her body, and it's creating gut irritation, and it's creating inflammation in her body, and it's draining her adrenal glands. So let's talk about what's happened so far. She went on a 6-week repair and clear protocol, which means she basically took in some healthy supplements that would help her with decreasing inflammation, like turmeric, resveratrol. She did nitric balance, nitric oxide, glutathione recycler, and she did vitamin D. Her blood, and we also increased her quantity of foods throughout the day. Her blood sugar went from 63 to 84. So that's a plus. It's still a little bit lower than what we'd like. And basically we know because her cholesterol levels went down that we got to get her to incorporate a healthy carbohydrate or a healthy oil or a healthy seed or nuts into her diet so that can come up nicely. Her hemoglobin A1C came down. So we see she is getting better in terms of controlling her blood sugar, but she is still tired and she does say she's improving, but we're not quite there yet. Her total protein, actually that was what it was this time, and it got a little bit better. So it's still a little bit lower than it should be. And so let's also talk about some other things that we did. We did an adrenal stress panel, and her adrenal stress panel is such that she let's see if we can erase this. Sorry. Let's erase this. All right. So we did an adrenal stress profile on 6/26. That was the date that she collected it. And we'll do another one here in probably one more month because it takes time to repair these adrenal glands. Even though we're helping her blood sugar levels out and we're trying to get her to eat a healthy protein, carb, and fat with each meal, we're trying to reduce inflammation, we're trying to clean up the gut, we're trying to remove the foods that she's reactive to, which we'll go over in a second, and we're also trying to detoxify the liver. It takes time for these adrenal glands to come back, even though we're trending in the right direction. Her morning cortisol between 6 and 8 was 11.6, and optimally it should be between 13 to 24. So right there, that tells you that she is low. She's not bounding out of bed. She's not glued to her sheets, but she's just not getting the relief or the energy output that she's looking for. Then at between 12 and 1, she is at 4.0, and she should be between 5 to 8.0. So we can see that she is still lower than what she should be. Then we look at her between 4 and 5, and she is at 3.6, and she should be between 4.0 to 7.0. So again, all these readings have been low. And then her last one, she's at 0.8, and she should be between 1.0 to 3.0. So you can see that she's low across the board. In fact, total cortisol sum is 20, and it should be between 23 to 42. So she is certainly in a chronic stress response. We can also see that her total DHEA is 3.1, and it should be between 2 to 10. So she's at the low range there, but the thing is when we divide 20, which is the total cortisol, by the total DHEA, she's at 6.45, and that should be between 5 to 6. So she's elevated there. She has a chronic stress response. She's starting to steal away the raw materials that produce DHEA and her sex hormones and her libido and her rejuvenation and her zest and her get up and go is being used to help her make cortisol. And so we want to see that really increase in all levels. And we've done a couple of supplements to help her. We actually put her on some DHEA. We did 15 milligrams per day. You can go up to 30 milligrams per day. And we're doing that for 30 days, and we're going to retest. But suffice to say, we can see that she's in a chronic stress response. The other thing we can see that we did with her is that we tested her food, and the good news was this was through Cyrex Labs, and we found that the only food sensitivity she had was potato. And sure enough, she told me that she loved potatoes. And so let's summarize this patient who's coming in here with adrenal fatigue, and we are going to go about naturally helping her with a functional medicine approach. Firstly, her blood tests were fairly normal. She didn't have a conclusive test. There was no TSH markers on there. She didn't even have white blood cell markers on there. So we had the bare minimum. We put her on a 6-week cleanse. We initially did her adrenal saliva samples and her food sensitivity testing, and we found that she was reacting to potato. However, for that 6-week cleanse, we did remove gluten, we did remove dairy, we did remove soy, we did remove all of the other foods that she could possibly be reacting to. And the reason we did that is because sometimes these food sensitivities could be falsely negative. There are complementary systems of the way our body will react to foods that aren't measured through IgG or IgA or IgM responses, and so we got to basically remove these foods as a prophylactic and then reintroduce them so that we can see if she is getting some irritations to these foods. Her cortisol response was 20. It should be between 22 to 40, and that's just too low. She is stealing away some of her DHEA, so we did do a 30-day trial of 15 to 30 milligrams, which is basically 10 drops in the morning, 10 drops at night. And we also had her, now what we'll do is we'll also have her go on some kind of immune support because her immune system is dragging in. And that's what I really suspect once we do clear up her eating habits and getting her stabilization of her blood sugars throughout the day through her adrenal support. She's still going to have something that's draining her adrenal stress account because her platelets are low and her white blood cells were low. Her platelets were low from a lab range, so they're actually quite low. And so we're going to do some kind of investigating through homeopathic procedures that we do in the office. That's bioresonance testing, so we can test for pernicious agents that may be stressing her, like heavy metal toxicities or food sensitivities or environmental toxins, pollutants, pesticides, other bacteria, molds, a lot of different things that could be stressing her, and we'll go on through a homeopathic approach. We'll retest her in probably another 30 to 60, probably 30 days for her adrenal glands, and she's happy. You know, I'll get her to do a testimonial because she's getting more and more energy. She is sleeping better. Her big concern was she is brain foggy. She's 38. She's got 2 kids that are less than 5 years of age, and she can't focus and concentrate, and that's come around quite nicely. So I hope that this edition of Your Adrenal Fix gave you a little insight as to how functional medicine looks at adrenal fatigue problems, and maybe makes you want to say, hey, I should do something like that myself, whether it's through me or a functional medicine practitioner. At least get all the blood tests done that you need to get done. In her case, she didn't have any thyroid antibodies, which was great because this tells me that she's not autoimmune against her thyroid, and it's more like a Hatfield and a McCoy battle between the adrenals and the thyroid. And as soon as we start addressing these main immune suppressors or drainers of her body, we'll really make some headway. And so what are some of these adrenal stressors that really kick the doctor's butt when we do another test and find out that it really hasn't changed? Potentially are gum infections or teeth infections, heavy metal toxicity, viruses, Lyme disease, Epstein-Barr, cytomegaloviruses. And for those, if we need to delve deeper and figure out if those are the things that are going on, we can go on a homeopathic approach to address those. So we still got a lot of work to do, but we're heading in the right direction. And I just wanted to give you a look over my shoulder on how I do a workup for someone who is suffering with adrenal fatigue from a functional medicine approach. Hopefully you liked my video today. If you did, please give me a thumbs up or a share or a comment, or be sure to check out my blog at Adrenal Fatigue Society, and I hope to help you in your recovery of your adrenal fatigue nightmare. Thank you so much.